So you've had several skin cancers with us,
Yes.
and traditionally we've taken out with stitches and sent it to the lab. I know we've done 3 recently. And how was that experience for you with the laser?
Terrific. It was so speedy and so effective. I thought no pain, whatever, and done very quickly and very expertly. Particularly, I was particularly concerned about the one on the eye because it was. It was there for a time, as you know. And I initially thought that it was part of the matter that it normally forms in the eye in the morning and you have to wash it out. And but that was not the case. It was really just on the edge of that. And so I was concerned about it because it was very close to the eye. And if it was not handled properly, it could have resulted in some loss of vision or some other problem with the eye, but it didn't happen. We all have faith in the good doctor here, so that was easy to decide to leave it in his hands.
So we got all 3 of those done in less than 20 minutes, right?
Yeah, exactly.
So traditionally also, since you're on blood thinners, we would have had to stop the blood thinners,
Right.
or possibly had complications of bleeding afterwards, or certainly some
Right.
precipitous bleeding during the treatment with the laser. We didn't have to stop those, correct?
Apparently not. So I was pleased about that part of it too. Obviously, I mean, the less we all need Medicare, medical attention, but the fact is that sometimes it's better to be efficient about it. And this was certainly an efficient way to do it. It was a new experience for me, and I was only concerned about it because I thought, well, what is this new thing all about? And how quickly does it work? I mean, with the proper wound care, which I had as a result of one of my carers who really took over and had experience with it before, and he did a good job with it, obviously, because it looks fine.
You've been a patient of mine for 30 years, and unfortunately I know that you're heroically dealing with your Parkinson's.
Right.
How would it have been to have to come in 3 times to 3 different
It would have
times?
been a problem. It would have been a problem, even with the good doctor's care and concern, but it would have been a problem for me. The transportation is difficult in the city, and so I was very pleased to get it done at one time.
Right.
In 20 minutes we were finished. I couldn't believe it. The doctor was even surprised that it worked so smoothly. But I must say this was a very efficacious way to do this. Speedy and very effective, obviously.
And we take a closer look at that with you.
Sure.
So this was the area that was treated, right?
Right.
And then we treated another one up here on the side of your forehead, and this is only a month ago, correct?
Right.
So between here and here, you really can hardly see anything. So just for anybody who may be viewing this in the future who has had experience with skin cancer, what things would you tell them to try to avoid so they don't get skin cancer going forward?
Well, we all know that all of us took advantage of the sun more than we should have. And that was because at the time they didn't have drugs that would preclude problems later, perhaps. But in any event, we have to be mindful that it can recur. And so the problems that our excesses when we were young people come back to haunt us.
So definitely like sunscreen, a hat,
Sunscreen, a hat.
sun protective clothing,
Sure.
sunglasses.
Absolutely. Common sense, really. It's hot. The sun is bearing down on you. Be careful.
Thank you so much, Ron.
My pleasure. Thank you, Doctor. As always.
It's a pleasure, my friend. Yeah, always.